Hi, good morning, everyone. Thanks for joining us today. I'm Karen McDaniel. I am Director of Compliance here at URL Insurance Group. I am filling in for Christy Wilbert today. I'm just going to be a quick introduction to Amy Curran, who is your Aetna broker manager for some of you. She's going to be going over some of the great extra benefits that the Aetna MAPD plans offer for 2023. Really quick before Amy gets started, on the right hand side, there is a Q&A box. If you go ahead and click on the top where it says there's a chat, there's Q&A, there's polls, there's handouts, click on the Q&A, and if you have any questions, just type your questions in there. And then if we have time at the end of the webinar, we can go ahead and get those answered. And then I don't believe Amy has any polls going on today, so you won't need that. But then on the fourth tab, there's a handouts tab, and that's any of the extra things that Amy could be discussing during today's webinar. So with that, I'm going to go and hand it over to Amy.
All right. Thank you, Karen. I'm excited to be back with URL for another webinar. We are doing different series with URL on different topics that we have with Aetna Medicare. So today we're going to be looking at the nation's benefits program. This is a flex card that you will see on some of our plans, and I'm going to go into details on how that works. We've been getting a lot of questions on it. I've been having a lot of trainings on it. So I wanted to bring it to you to, better educate you so then you can in turn take that information to your clients and help them with any questions or, also with your selling needs as you're going out into the field. So we're going to focus, like I said, on nation's benefits today. I will say, just a quick plug, we do have a vendor showcase next week, February 14th. I believe that starts at 9 a.m. or 9:30 a.m. If you aren't already signed up for it, I highly recommend it. It will go over all of our extra benefits for 2023, many different vendors, Nations Hearing, dental. So a really OTC, so really good webinar to tune into. If you need more information on that, please reach out to your broker manager and they can get you additional information. There is also a webinar on dental, specific to dental, at the end of February. So again, if you would need more information on that, please reach out to your broker manager and they can assist you. So just wanted to mention that before I start this presentation. So let's look at the nation's benefits flex card program overview. We're going to look at, what it is. We're going to look at how a member utilizes these cards, and it's actually just one card, but how they utilize this card, what they get with this card, how they receive this card, and then also answer any of your questions. And I have some frequently asked questions and answers as well. All right, so let's go into the Flex Card Solution overview. So Aetna Medicare for 2023 partnered with Nations Benefits. So when you hear Nations, that means it is our Flex Card, our extra benefits card. You'll see what it looks like right there on your screen. On the right-hand side, it is the Aetna Medicare extra benefits card that some members will get, and I'll go over all of the plans that utilize this card. This enables members to pay for things like healthy foods, groceries, utilities. So that does include your gas, electric, garbage, water, and then also your cell phone or your internet bill. It also will include transportation on this card. So you can use that, and I will go into greater detail, but you can use that if you want to use an Uber, if you want to use Lyft, if you want to use this card to buy gas at a gas pump, you can also use this card. So really nice, flexible program if you want to, like I said, pay for gas, but it does need to be at a gas pump. You can't actually go into the gas station and pay for your gas with this card. It has to be used at the gas pump. You can use this card for gas at any gas station. So it isn't a specific network for gas if you use this card via the transportation at a gas station for your gas. And then also there is another bucket that you can use for OTC expenses as well. And again, so this side of things is specifically to the D-SNP plan in central Pennsylvania. So the D-SNP members will get this extra benefits card, and they can use it towards healthy foods, utilities, transportation, which does include gas, and then OTC expenses. For the D-SNP, on this card, they get $360 on one purse to use towards quarterly towards those items that you see on your screen. Again, and then they can access, I will show you the member portal that they can access, how much money they've used, what they have left over, and, they can also do a search for eligible items as well through Nations Benefits. Also, let's see. Now this will show you. So Nations, we have one card for D-SNP, and that, like I said, will include your groceries, which is healthy foods, utilities, transportation, and OTC. So that is one card, and that is for D-SNP members only. So they will get this card, and they have, they can use those 4 things on this card. And it's $360 for Central Pennsylvania, the D-SNP, $360 in this area quarterly to use towards those items. Now, where there gets to be a little bit of confusion, and that's why I wanted to do this webinar today, is also there are, and you will see right there on your screen, some other plans that offer a Nations Extra Benefits card for healthy foods only. Okay, so you'll see them right there on your screen, which plans are eligible. One that I want to point out is the Aetna Medicare Advantage HMO plan. This is our MA only plan. This plan, if somebody is eligible and they are on that plan, they will also get an extra benefits card for healthy foods only. And they do need to have a qualifying condition, a chronic condition, to be eligible for this card. So I have a listing. I have a really nice flyer on under the flyers tab, and it will go over it's the Aetna Flex Insert Package, the SSBCI. Also, there's an extra benefits card broker flyer that lists all of the conditions that one would need, especially, on these plans, as I mentioned right here, but also on the Aetna Medicare Advantage HMO plan. So not everyone on that plan will get this card, but there is a listing. They must have a chronic condition, and I'll give you more information on that here shortly. Also, there is also plans that eligible members are eligible to get the extra benefits card for healthy foods if they have a condition of chronic CHF. So that is affecting the heart. So if they have a condition of CHF, they would be eligible to also get the healthy foods card. And you can see the plans there that are eligible under that condition. Okay, so it gets a little confusing. So just think of it. There are 3 different areas that get this extra benefits card. D-SNP members, they will get one, and they can use it towards groceries, utilities, transportation, and OTC. They get a card. Also, if certain people have certain conditions and they are on one of the plans that are listed on the screen, they would also get a card, an extra benefits card through Nations. And that is for healthy foods only. The groceries and the healthy foods only is network based. So the grocery store does need to be in our network. I will say that we are expanding the network. So if you ever run across a grocery store that's not in the network, you can reach out to me. Chances are they have been nominated, and hopefully they will be added to the participating retailers soon. And there is a list of the retailers that are participating out on Producer Worlds, or you can also ask your broker manager for it. So hopefully that, better answers your question of what this card is and who gets this card. So let's look at the member journey. So Aetna members will receive their benefits card in the mail. So they'll want to make sure that they look for this envelope right here. It's basic. It's a basic white envelope. They will get a card in there. They will also get a benefit insert. So it will, let them know where they can go, the member website to, find out all of the information. And then also they will need to activate their card. This is very important. So there will be a sticker on there that they do need to activate the card prior to using it. So that is, again, what the custom card will look like. I always like to show agents what the members will be receiving so they can be on the lookout when their mail is coming to look out for this card. And I believe they would receive the card, I believe it's 7 to 14 days after they become a member. And that's when they should be looking out for that card in the mail. So members will be required, as I mentioned, to register prior to the card usage. So they will have to go to this website, and then they can click register, and then they'll just input all of their information. And then once they are registered, they'll be able to log into their member portal they would use their member ID. So that's important. So they'll use their member ID, and then they would use a password as well. So that will give them access to the website to view all of the necessary information that they need to find out about this card. It will tell them how much they've spent, how much they, have still available for the quarter, as well as, eligible items as well. And then they can also look up stores that participate too in the healthy foods section for groceries. And right here is basically what the website will look like. So there is a wallet view. Like I said, it's just a running tab of what they have available to spend. There is a listing of OTC products. So if you do have this plan with the D-SNP and they use this purse, $360 in there for their OTC products, it will list out, approved CMS OTC products. They can also get them in the stores as well. So they're not just limited to, with the D-SNP, like they're not limited to the CVS stores. There's also other stores participating, and I do have a listing of that. There's also recommendations. So if they have a specific chronic condition that they have, there is a listing out there that tells them things that might be able to help them, in their health journey, and what they can use to, buy things with this card. So that's basically what the website, the member website would look like. As I mentioned, they do need to activate their card, so they would receive it in the mail, and then they can register using their card, and then also their personal information. They can, they don't have to do it all online. There is also a toll-free number that I'll give you at the end of the presentation to activate their card. So we realize that, not all members use a computer. So there is also a way to call in and activate their card. And then once it's activated, the member can use their card at participating retailers. So again, it's a specific list. We do have participating retailers for grocery stores, for your healthy foods, OTC items. But as far as transportation, as far as if somebody wants to use this card to get gasoline in their car, they can go to any gas pump, and they need to use it at the gas pump. So I've gotten a lot of questions on that one. So that's why one of the reasons I keep repeating myself and bringing up the gas situation, because I know that's a popular one with this card if you are a D-SNP member. All right. Let me give you, so next up is the member services. So if somebody does have questions, or, their card isn't working for whatever reason, they can go to the website. The website is right there on your screen, members.nationsbenefits.com/Aetna. There is also a toll-free number. The toll-free number, let me see. I believe I have it on an extra benefits. I don't believe that number right there is correct. So I have it is on one of these flyers, which I'll share at the end of the presentation. You can also, I believe, download them right now. And the phone number is right there for you. I thought I wrote the phone number down, but I mustn't have. So I'll make sure you get that extra, or that phone number that is correct. It is on the flyer, and I'll point it out to you as I bring up the flyers at the end of the presentation. But the member experience advisors are available 24 hours a day, 7 days a week, 365 days a year. So there is always somebody to help them if they do have questions. And they would be reaching out to Nations. So it's not directly to Aetna Medicare. They would be reaching out to the company Nations Benefits to help answer their questions. So there is member services for that. So I've been talking about, what you can do with this card and how you can use it. But I do have, some more extensive things on it. Nations Benefits understands that members are consumers. So they, want to make sure that they're there for them to order what they need and, get the most out of this benefit. So again, some of this is repeat, but they can order through online. They can order through the phone. They also can do mail order as well. And then they have that specific card that they can use. It is a credit card. It is not a debit card. This is another question that I get a lot. This card that they will receive is a credit card. So there is no PIN with this card. I get this question a lot. People say, well, I'm trying to use it and it's asking for a PIN. Bypass the PIN because it is not a debit card and there is no PIN with it. So whenever you are at a gas station and you're using the card, you need to leave the card in the chip reader. So don't put it in and out really quickly. You need to leave it in the chip reader. Actually, they need to put the card in the chip reader and take it out quickly. I'm sorry. So that's how that works at the gas station. So again, it is not, this card is credit only. So it will not have a PIN. So, and that's a question that I receive a lot of with this card. So for OTC items, there is a robust formulary that includes hundreds of quality brand name and generic products for OTC items. So they will also receive an OTC. Now, this is for the D-SNP plan only, is where you can use this card for OTC items. They will receive a catalog in the mail. They can also get them in the store. Don't forget that. They can go to a store if they want, but you will see. So the D-SNP plan, if you do sell this plan, it has its own OTC catalog versus the other regular plans. So they will get a catalog. They can use it towards OTC items on the D-SNP plan only. So it is a catalog, as I mentioned, but they can go in store. They can order online over the phone. And, if they do go in store, they would want to show their Nations credit card, as I mentioned. That looks like this. If they do order their OTC items in store, they would want to use that card on the D-SNP plan. So again, the catalog for D-SNP OTC, you will see it says Nations on it. And that is for D-SNP only. And then there is an OTC catalog for our regular products that is outside of this card. So if you do have questions on that, I know it gets a little confusing. If you do have questions on that, definitely reach out to your broker manager. They can get you all of the information that you're looking for, or if you have any questions. The grocery benefit. So if you remember from the beginning of the presentation, on the D-SNP plan, they can get healthy foods with this card as well. They can also, don't forget, on some of our regular plans, or our other plans, I should say, they are eligible for healthy foods only with this card on some of our other plans. And that listing is in the beginning of the presentation. So with that card, they can get healthy foods. There is a selection of items. So there is a number on these cards or on these items, so they know that if it's a filtered spend SKU, so they'll know that if it's an eligible item. It's not like they can go into the grocery store and, get some alcohol and cigarettes and, chips if they wanted to. It's going to flag that. So it's set up in the system as a way that, it knows that it's fresh fruits and vegetables, dairy products. So it will know what is approved and not approved. And these members can also go to that website, the member website, to look up if something is approved on the grocery benefits. So that is for healthy foods. So SKU blocking ensures that members are only able to purchase approved products. So we do have an approved list already in the system. And then again, members will be able to see their remaining balance and their previous transactions. So they'll be able to see how much they have left over for that quarter. So grocery benefit, healthy foods on certain select plans for people with chronic conditions or CHF. And then also the D-SNP plan. The grocery benefit is a network of groceries. So they have to be a participating grocery store or convenience store. And that listing, as I mentioned, is on Producer Worlds, as well as we also have a listing as well that your broker manager can send to you. So the grocery benefit, as I mentioned, is a participate. They can't just go to any grocery store. They would need to be participating with the nation's network. Right, transportation and utilities benefit. So transportation, as I mentioned, now this would be included on the D-SNP plan. So select Aetna members, so that would be D-SNP members, will have the flexibility to use their Flex card towards eligible utility and transportation expenses. So again, it is one purse of $360 on the D-SNP plan for Central Pennsylvania. And this is that nation's extra benefits card. So for transportation, they can use it towards, taxi cabs, towards Uber, Lyft. And then one of the more popular things to use this card with is, I've noticed over the past couple of months, is the gas. So again, just a reminder, they can go to any gas pump and pay for their gas. It would be used as a credit card. There is no PIN. And they cannot go into the store to purchase their gas. So it wouldn't be, prepay. It has to be prepay at the pump with this card. And also utilities. So they can also use it towards utilities, and that's electric, gas, heating oil, water, cable. Also their telecommunication services. So for their cell phone, or if they still have a house phone, as well as computer network as well. So many different items that individuals can use this card for. So, a lot of flexibility with this card. So that is, you might hear it referred to as a flex card, but, the savings to their budget comes in many ways. So if they use $360 for utilities and gas instead of food, we're still helping them save $360 in their budget, to buy food anywhere they want. So, as I mentioned, many different ways to use this card, especially on the D-SNP plan. Both transportation and utility purchases will be pulled from the flex allowance if it is eligible. And again, they can track everything that they're spending online on the website, or if they have questions, they can also call into that member services number. So again, I've been mentioning this. I'm kind of going through the slides, ahead of time, but balance tracking, they can go online. They can also call the toll-free number on the back of their ID or on the back of their nation's card to find out what the remaining balance is. Or there is also a Nation's Benefit app that they can, download on their phone if they're able to do that, to be able to easily check, how much they have and what they've spent their money on for the quarter. So our distribution centers are strategically dispersed across the United States to make sure that all of the members are getting things quickly. So if they do order, say, OTC items online or grocery items online, they have come to expect that it is a 2-day delivery guarantee. So all products listed on the Nation's Benefits website are approved items and available for purchase. So you don't have to go in store. You can order things online for your healthy foods, your groceries, as well as your OTC items. So you will see there's 5 different distribution facilities. Most likely everyone on this call, we're focusing on the Pittsburgh Distribution Center. So, I mean, there's others, but probably most of our items for our members will be coming from the Pittsburgh location to, meet that 2-day delivery guarantee. There are no shipping costs for the members if they do choose to order it online or over the phone. So again, that would be for your healthy foods, as well as your OTC items, if you choose to use this Nation's Extra Benefits card for those items. So there is a retail network where members can use their card. Now, this would be for healthy foods as well as the OTC items. Cashier and retailer staffs are familiar with the MasterCard logo. So it is, as you see, it is a MasterCard, and they know how to process the transactions. So these are some of the participating providers. Again, I mentioned you can find an updated list on Producer World for the updated retailers. So it's nice with, say, the OTC. If they have OTC on their benefit card, most likely just with the D-SNP plan, they don't have to just stick to CVS if they want to order items or, go to a store. They can also go to Walmart. So that is where also you can get your healthy foods, Walgreens, Rite Aid, and then some independent retailers are out there. You can go, as I mentioned, on Producer World to get that information. So members can scan for eligible items through their mobile app as well, or by calling Nation's Benefits to, see if something is eligible. So again, and no PIN is needed for this card. So Nation's Benefits offers multiple ways for members to check and track eligible items. I think we all know that now. There's a member portal. They can scan through My Benefits app. So on the My Benefits app, there is a feature called Product Eligibility Search. Members can use the barcode scanner and search for eligible items. So if they're in a store and they're not sure if something's eligible, they can scan it with their phone and it will come up to, let them know if something's eligible. They can also call customer service if they have any questions. They're also always there to assist the member as well. All right, some questions that I mentioned, or I might have mentioned these as I was going through the presentation, but how long does it take for a member to receive their card in the mail? So cards will arrive in the mail 7 to 10 days after the initial record is received. So they need to become a member with Aetna Medicare. And, then we would send the eligibility file to Nations, and then they would then receive their card 7 to 10 days after that initial record is received. So if a member misplaces their card, they can request a replacement card either over the phone or through the member portal. So sometimes, or if they say they haven't received it, it does, again, come in a white envelope. So they might have, if they threw it out, if they, again, misplaced it, they can call in and request one. So when a member is ready to check out, now this says they can run it as a debit. It should be run as a credit card, and you would forgo entering a PIN. So these members do not enter a PIN because they would want to run it as credit. So hopefully that answered some of your questions on the Nation's Extra Benefits card. So I'm going to share my screen real quick, and then probably only 5 more minutes of your time. But let me share my screen just to be able to show you me share my screen. Hopefully you can see the flyers okay. I'm going to pull them up here real quick. Let me see. I'll do preview. Hopefully you guys can see it. But this flyer is really nice. It really explains the extra benefits card really nicely, really easily for you to understand. I know I went over a lot of information with you in a short amount of time. Hopefully it wasn't too confusing. Just many different pieces with this card. So I understand if you do still have questions, reach out to your broker manager. So this explains what all you can use with that Nation's Extra Benefits card. Here is the phone number. As I mentioned, this updated phone number is not on the slides that I have shown to you. So the Nation's Benefits member services number is 877-204-1817. So that is, and then there's the website as well. So if you don't have this flyer, I believe you can download it right here on your screen from this portal from URL, or if you do need it, reach out to your broker manager. It also goes over what you can use for utilities, transportation, just some other details. Again, it tells you about the quarterly, so it's on the first day of each quarter. The number again, and this is where, as I mentioned, on some of our plans, you can get this card for healthy foods only, but you must have a chronic condition. So this lists the chronic conditions out. Members can also self-attest, if they do have one of these. And then also clinical staff we do use claims data as well to confirm if somebody is eligible with this chronic condition. So, and then also on some of our plans, it is a congestive heart failure value-based insurance design. So some of our plans, which you would see they're all listed out here on this flyer. Some of our plans, you must be CHF and you agree to participate in the Healthy Heart Partnership Program, care management program with extra benefits designed to help manage their CHF. And that is on some of our plans as well. So, and then this flyer is so helpful. I refer to it a lot because, it's just a lot of moving parts with this card that I'm talking about today. But this will list out, I'm trying to get to PA, this will list out all of the plans that is eligible for this card. So it will tell you that this card, on the Silver HMO POS plan, the number, these individuals, they need to have a chronic condition. So that is SSBCI is your indicator there. And it will tell you how much it is, and it's for healthy foods. Whereas this one says the Aetna Medicare Premier Plus plan is the CHF. So the Healthy Heart Program, it tells you the amount and for healthy foods. So really nice, plan to a really nice flyer to look at if you do have additional questions. It really summarizes what I went over in the presentation in a couple page flyer. So really nice to refer back to this. There is also one that is specifically for the chronic condition extra benefits card. So again, this is another nice one that I just found online that would also be beneficial to have in your packet of information when you're going to meet with members. So this is the chronic condition one. And then there is also one specific to the congestive heart failure. And if a member is enrolled in the Healthy Heart Partnership Program, and for those plans that are eligible for the Nation's Extra Benefits card. So really recommend you looking at these flyers. I'm going to stop sharing my screen before I forget to do that. But, I really recommend, I know I went over a lot of information and it can be confusing. This card, it does give members really a lot of flexibility, especially the D-SNP members, to use money towards really good items to help these individuals. So, I hope you found this helpful. like I said, I know I went through this quickly. If you do have questions, please reach out to your broker manager. I guess what I'll say is, Karen, are there any questions? I don't know if I can see them on my end. Did anybody come up with any questions as I was talking?
No questions.
Okay.
Sorry, no questions.
All right. So hopefully everybody understands this. It's super clear. I felt like I was presenting and I was kind of all over the place, but it's just a lot of information. Hopefully you found this very, very helpful. This is one of the more important cards that we've been getting questions on. So if you do want more information, there is going to be a speaker from Nations on that February 14th webinar, the vendor showcase, that will specifically focus on the Nations. A lot of this will be review. So, it kind of gave you a little bit of a taste of this card. And then, if you think of other questions or you want to hear it again, please log into the vendor showcase on February 14th. And you can get even more of your questions answered there. So again, thank you for joining me today. And if you do have questions, if you need anything, please reach out to your broker manager or URL, and we would be more than happy to assist you. So thanks again. Have a great day, guys. Bye.
Thanks, Amy.
Thank you. Bye-bye.